Hi, hello everyone. I'll wait a little bit to see more people are joining us in this live event. I have now invited my colleague, Dr. Fabrizio Rosso, to join us. I'm waiting for him as well. So before Fabrizio joins, I will start to introduce myself first of all. Before that even, I should say good afternoon, good evening, good morning to all of you who are now live on Instagram with us from wherever you are now. Thanks for joining us in this live Instagram session of the EuFMD. I should say this is our first ever session. So I'm really happy and pleased that I have had this opportunity to be with you on this Instagram live event. So my name is Bouda Ahmadi. I am a veterinarian and agricultural economist. I'm working for the European Commission for Food and Life Disease, the EuFMD, of Food and Agriculture Organization of the United Nations based in Rome. The reason that we are organizing this live Instagram session is to introduce you to our Open Session 20, which is going to happen in December this year. I'm now trying to invite again my colleague, Dr. Rosso. I hope this time he will accept our request. I'm still waiting for Fabrizio. So please bear with me for some time until Fabrizio joins us. Hello again to those who are joining us recently. I'm just trying to connect with Fabrizio. Just bear with us.
Hey, Bouda.
Hi, Fabrizio.
Hi.
Where are you?
Sorry.
No worries, no worries. How are you doing?
I'm fine. Actually, I was finishing painting my wall in the EuFMD color.
That was too late. We should have done it before. But okay, that's fantastic that you managed to join. Where are you now? Tell me.
I'm well between Malta and Rome because I live in Malta, but I work in Rome. So in this time of COVID crisis, it's quite a bit challenging traveling to the headquarters
Sure.
in Rome, and also we should respect of 14 days of quarantine after the traveling because of the security of the premises, the headquarters, and so on. So, but I think there's a challenge that we are all facing, and it's
exactly. Yeah, I'm sure everyone agrees on that. So perhaps that was quite good. I mean, I started with introducing myself, but I will repeat it because I see many people are joining, still are joining us. So I'll briefly introduce myself and then give the floor to you, and then we can discuss about our open session if you agree.
Perfect.
Good. So my name is Bouda Ahmadi, and I am a veterinarian and agricultural economist working for the European Commission of Food and Mouth Disease, based in FAO in Rome. And I'm very pleased that we are organizing this live event, live Instagram event for the first time, and this is dedicated to discuss about aspects of our open session 2020, which is going to happen in December. So without this platform, will provide us some very friendly environment to discuss about that. So that's my introduction. Fabrizio, would you like to also to introduce yourself, and then we can go to the details of the conference, perhaps?
Thank you, Bouda. Yes, I'm Fabrizio Rosso. I'm a veterinarian and currently the Deputy Executive Secretary of the European Commission for the Control of Foot and Mouth Disease, the EuFMD. I've been working with the EuFMD since 2014 now, following different activities, the risk reduction program in the European neighborhood, other activities, and now, try to look at the whole commission and activities, and of course working for preparing the open session.
Sure. And you should be very busy, are you?
Well, I think as everybody in this, in particular in this period, so not more, none less than others, I would say.
Yes.
It's always difficult to say, well, I'm too busy or I'm not busy, because it's yeah.
Right. But it's a good business, because I'm sure you like what you're doing, and so it's the same with me, and I think the whole EuFMD team. So maybe we can start discussing about our open session, if you agree, Fabrizio. I was reading the title again this morning, and we have used some terminology, some words there. So it would be nice for our audience, I think, to hear from you. Maybe you can explain what is livelihood at risk in a faster world. So each of these terms, I think, needs some sort of description, and you are the best person to do that.
Yes, I think that the title address different needs and highlight important aspects of our work. And livelihood, I think we wanted to highlight the importance of increasing the resilience of livelihood to threat and crisis, which is also indeed one of the FAO strategic objectives, and also key towards the reduction of poverty and hunger, which are the strategic two of the strategic development goals of the United Nations. And so we wanted really to highlight the importance of livelihood. And then the title says livelihood at risk. And in recent years, we saw that foot and mouth disease, but also other transboundary animal diseases, have made a really frequent jump, intercontinental or interregional incursion. If we think of, for example, the outbreaks in North Africa of FMD in 2013-15, that were actually due to a strain, an FMD strain that was coming from India, Nepal, and Bangladesh. And if we go back to the UK outbreaks in 2001, it was the same. And we have really different. If we look at North Africa, for example, in 2018 and 19, there was a strains coming from East Africa. So really the different regions are always at risk. And I would say that this current COVID-19 situation might have also improved such risk because there is a well, the crisis has affected the activities of many, including also the veterinary services, especially at the beginning of the crisis. And a lot of veterinary services and laboratories were also involved in the response to the COVID crisis. That was a very good thing because it was also a recognition of the contribution that the veterinary service can provide also to the to the humans. So the One Health approach might also apply to this current situation. And Bouda, you probably know better than me. You are an economist, agroeconomist, well, you are veterinarian, but that is your specialization. You probably know better than me the impact of such diseases to the livelihood.
Well, yeah, definitely. I mean, from economics perspective, all these diseases, well, especially foot and mouth disease, for example, I think will have impose substantial losses to the societies and also to the farmers and to the industry, livestock industry. But I mean, as you mentioned right at the beginning about the achieving the Sustainable Development Goals of the United Nations, I think that the focus that we have here is very much in that direction to address at least a couple or more of these issues as far as we can. I mean, you talked about economic burden. I mean, look at, for example, foot and mouth disease. It's estimated the global loss due to foot and mouth disease is about $21 billion US. And this is only direct production loss and also cost of vaccination. So it's huge. Of course, it's being it's varied in different regions of the world, but still is huge. And if you think about the impact of this disease in livelihoods of smallholders, for example, or all those endemic countries that we are targeting, I think it's massive. It's massive, and any step towards improving the control measures would be really helpful. And also, I wanted to say for European countries or for free, let's say, states that we are trying to also protect their freedom from the disease. Any outbreak would be also very very bad for the economy. As you mentioned, for example, 2001 outbreak in the UK imposed like £8 billion of losses to the society. 2 billion was to the public sector and 3 billion to the private sector. So the impact is really massive, and it's very much at the center of the focus of any policies. Right. Okay, Fabrizio, if you agree, we get out of the economic a little bit and go back to risk. I know there are items that we are covering in the open session. Maybe you can reflect a little bit on monitoring and risk mapping and all those subjects that we are covering in the open session.
Yes, indeed. Well, back to risk. Let's say the open session will be actually focused on monitoring and mapping risks. Considering different risk factors, and one important risk factor that we would like to highlight and consider in the open session is actually the animal mobility, and as well as how the risk changes can be better addressed by improved surveillance and control. So try to understand really what are the indicators that can assist in forecasting changing of risk, changes of risk. Particularly, we thought of focusing, particularly the first session on the first day, on really reflecting on how animal mobility can be better monitored and how indicators can be identified for assessing such risk change. And then on the second day, we will reflect on how we can pass from risk really into action. So how we can really address those risks and risk changes with improved surveillance and control. And then we have the last part of the session, Bouda, the open session, the 4 days, which actually will be the open session will be longer than 4 days, but let's focus first on those 4 days. And
yes,
the other 2 days will be more dedicated on how policies and preparedness planning can be enhanced to better face crisis. So in terms of vaccination, vaccine availability, but also resources that should be mobilized in a crisis. And then we will pass on long-term resilience to crisis. So not the first response to a crisis, but more how to guarantee in a longer-term crisis business continuity, for example, or greater resilience.
Right. Perfect. I see questions are coming in, Fabrizio, but I suppose maybe we answer questions at the end. What do you think? I mean, we can start.
I think that we can go through when they come.
Right. Okay. But I think also we can collect them. But if you want to, we can.
Like with that.
Thank you. You are my boss, but okay, I'll go ahead. If you agree, maybe we can go a little bit to the structure of the open session, and maybe you can first of all you tell us about what's the purpose of open session and how often is being organized, and then I will go through the numbers of the participants and all those details after you.
Yeah, okay. Well, you are actually the scientific coordinator of this event, so you know better than me the details. But the open session is an event that is organized every 2 years by the Secretariat, by the EuFMD, and it is indeed it is called open session because it is the open session of the Standing Technical Committee. We have the Commission has a Standing Technical Committee which assist the Secretariat in directing in scientific research, as well as highlighting relevant issue related to EuFMD control. And years back, the Secretariat thought of having this open event, really open to the science, to the scientific community, not to be restricted to that standing committee, but actually open doors for collecting results of studies conducted in different parts of the world. Right.
What a great idea that was.
It was actually a great idea, and the last sessions there were a lot of participants. I think that there were around 250, 300 participants physically present and 500 attending online. But I think that for this session that there will be more.
Yes, indeed. So far, I should say we have like about 1,200 registered participants, and we expect that is going up, and we expect it's going to be beyond 1,500 participants, and this is very encouraging and quite a big number. Let me say also we will have 16 distinguished keynote speakers in 4 days of the open session. And all of these people are experts in their field with huge amounts of experience and knowledge in the items that we discussed and we are discussing about. And I'm pleased also to mention that we have received about 104 abstracts for either oral presentation or poster. And given the time that we will have in our virtual sessions, because it's going to be online, and given all those aspects that people shouldn't get tired to listen to presentation and so on, so we have decided to give like short talks, about 10 minutes talk. So we will have 32 of those great works be presented as recorded presentations. And of course the presenters will be available online, so in the question and answer session they will be available to answer questions. And the rest of the papers will be presented in a poster format, but I should say it's going to be very exciting because it's not very conventional way of presenting posters. I mean my colleagues, your colleagues are working on this aspect and make it quite interesting to go through the poster. So I really encourage everyone to download our apps and also get in touch with us to know more about how they can view the posters, especially in this particular event. So all these will be virtual and online, so no physical basically events will be happening this year. Is there any point you want to mention, Fabrizio, on that? Or
yeah, thank you, Bouda. I think what we are trying to do with the EuFMD activities is to think of the activities and think how we can innovate this activity that we are going to deliver, and how we can innovate this one. This works for training, this works for workshops, this works for field activities. And for the open session, considering the current circumstances, we thought, how we can really innovate and the format, the structure, the environment of the open session. And I don't want to anticipate a lot, but the environment of the conference will be very interesting. We will not, unfortunately, have the possibility to meet physically, but it will be like actually a physical meeting.
Yeah, that's going to be very exciting, and I've seen some demo of it. It is very exciting. So I should say you will have the similar feeling that you're attending a live event, which is quite nice. Well, if you agree, there are a couple of questions. First of all, aside foot and mouth disease, which other transboundary animal diseases are you planning to cover? Would you like to answer that?
Okay, yeah. Well, historically, the EuFMD has been created to coordinate actions for control of foot and mouth disease. But in the last year, at our general session, which is a session organized for member countries requested to enlarge the scope of the activities of EuFMD. And now the focus remains FMD, but with the concept on expanding and building on good principles for FMD control, and try to apply those to other transboundary animal diseases that are similar in nature to FMD. So lumpy skin disease, PPR, sheep and goat pox, Rift Valley fever, bovine ephemeral fever are other diseases that actually are covered by our program.
Right. Excellent. Thanks very much for that. Fabrizio, we received questions. How it's possible to attend, how we can register. I suppose that the best answer would be you need to go immediately to our website, because the places are being taken very quickly. So please go to our EuFMD website. We will post the URL here, and then you can register under our OS 20 webpage. So and then how you can attend, you will receive instructions. You will receive how you can access to these sessions once you register. So please go to our website and get the latest information, and there you can register. So if there is any other point you want to mention, Fabrizio, please do that. Otherwise, we can introduce the 4 sessions that we are planning.
Yeah, well, maybe, yeah, okay, go ahead. I think it's
all right. Okay. So we will see. Maybe other aspects will be mentioned or at the end. So yeah, as we mentioned, this year's open session is completely virtual, and we are organizing it in four days. Well, the conference will be organized in 4 days, and each day is dedicated to one theme. So the first session will be held on 8th of December, and it's on measuring animal movements and drivers for fast risk mapping. Fabrizio mentioned about risk mapping, so we don't go to more details now here, but what I can say is all about scrutinizing how animal mobility, drivers, and network analysis could contribute to risk of animal diseases such as foot and mouth. That's our main focus, and how risk mapping basically and monitoring and movement of animals could help us to better prepared and better predict and better allocate our resources for controlling of these diseases. So that's our first session, and Professor James Wood will chair that session. And we have received a very good number of high quality papers on that session. And yeah, I just can tell, okay, come and visit and listen to those presentations. It will be really fantastic. I know, Fabrizio, risk mapping and that risk mapping is really has been your area of focus in the last years. Maybe you want to add some more on that.
Just saying that it's really a participatory activity, and it's something that you can only build together with the with people on the ground that survey and monitor the animal movement and identify those risk factors such as the market prices or climate situation that can drive that movement partners.
Sure. Right, great. I'm cautious about time, so we go ahead. At session 2, our second session will be held on 10th of December. So this session will be focused on risk to action. And the main aim is to consider how improved surveillance, control and prevention measures will address properly risk changes and forecast. So we are basically looking at how dynamics of risk can be mitigated by targeted and timely prevention and control measures, and also how cost-effective cost-benefit analysis can assist risk managers to prioritize actions according to risk. And also how risk communication could help us to better organize our surveillance and prevention and control in the digital era. So this is the main theme of this session, and we will have another number of good papers have received on this session. Would you like also to elaborate a little bit on that? And before that, I should say Professor Katerina Stark will chair that session.
No, just a reflection saying that we start from risk, but then really we would need to reflect on how that risk and risk changes can be addressed with the improved surveillance. We know that analyzing animal movement, for example, we can identify risk hotspots. So why not reflecting on how best implement integrated surveillance, not only for FMD, but for similar transboundary animal diseases in such hotspots. And that we want to reflect on that in this session.
Right. So what you're saying, if we follow the order of sessions, we see a logical progression towards control. We start from the risk, and then we come to surveillance, and then in the third session, let me introduce that one. We look at vaccine security and critical resources for emergency management. So I know vaccine security is one of the core aspects of our current program in the EuFMD, and the aim of this session is to compare national and regional approaches to ensure sufficient critical resources in fast crisis, including quality vaccine and diagnostics to ensure proper response during multi-country epidemics. So the importance of vaccine security has been mentioned in different occasions that we have had so far. But this is again a great opportunity that we can hear from experts and researchers who are working on aspects of vaccine security and also diagnostics, which is very core in all efforts to control animal diseases. So I give the floor to you to talk about that a little bit, and also after that I will say something special about that aspect as well.
Yes, and like here I think, well, we wanted to actually compare national and regional approaches, initiatives to ensure critical resources in FMD and other fast crises, including, as you said, the vaccines and diagnostics. A lot of questions here on how to better address that, and we have actually seen in the COVID situation at the beginning of the crisis that it was basically the same also for the human side. So how to ensure proper response to the crisis in timely manner.
Right. Yeah, in fact, the COVID situation is quite unfortunate, but there has been lessons to learn, and also there are similarities with previous experiences which we have had in livestock the diseases. And I know our CVO in FAO, Dr. Keith Sumption, has just published a paper on comparing COVID with FMD outbreak in 2001 in the UK. So there are comparisons to be made, and also vaccine security is one of the most important aspects of that. So yeah, one thing I just wanted to say that we are also having a special edition of Frontiers Journal dedicated to socioeconomics of vaccine security. So there is opportunity to submit papers to that, which is associated to this open session of us. So I think we are coming now to the last session, which is our fourth session. That's on resilience to long-term fast crises. And in that, we are going to emphasize on importance of preparedness and planning to help ensure animal welfare, supply chain, and business continuity in prolonged emergency responses. So as we see also in COVID-19 situation, the business continuity is quite important, and also in case when we impose control measures, for example, movement bans, etc. So this aspect will be very important, and also animal welfare. So I think, as we said, the progression of the sessions goes towards the better being organized to control crisis. So I see it at least in that way. You have any comments on that?
Well, nothing actually to add to what you have said, but I would like just to mention that actually the 4 sessions that you have just explained will be part of the core of the open session. But the open session will be actually extended till the middle of February, because within we're connected to the event. We are planning several workshops, 5 workshops to be held between January and the first half of February, because we wanted to really dig a bit more in the topics. So it will be mainly restricted, not all of them, but most of them will be restricted to scientists which can bring different expertise, but again, focusing those workshops on better forecasting of fast FMD and similar transboundary animal disease spread, targeted surveillance and control measures and communication of risk, and also protecting the vaccine security and secure quality vaccine, and also protecting livestock and related business and livelihood from crisis. So dedicated activities will be then organized, linked with the 4 days that you have just mentioned, explained.
Right. Okay. I just recall that I didn't say the dates of the third and fourth session. So the third session will be on 15th of December, and the last one, the fourth one, will be 17th of December. But these are the conference aspect, as you said, and we will continue with workshops in January, from December to January, and then the last one, I think it's in February, if I'm right.
Yeah.
And those workshops will be opportunity to go deeper in all those aspects, and basically there will be opportunity to discuss in more details aspects that perhaps there wasn't that much time to reflect on in the open session.
And
I think
I said that the workshops will be some of them will be restricted, but then on the 16th of February there will be actually a day, maybe not the whole day, but an event organized to provide the conclusions of the open sessions. And so we will feed back all the participants with the conclusions of the 4 days of the conference and also the workshops.
Okay. Well, thanks for that. That's very important then. So, well, we don't encourage anyone to miss the opportunities of attending those events. But in case if anyone cannot attend, he or she can go to the last closing, let's say, session and see, hear the conclusions. We have a number of questions, Fabrizio, but I am cautious of time. Maybe we should close this first live Instagram live event. But before that, maybe we answer this question. Could you please explain how the OS supports EuFMD's work plan?
As I said, it is the open session of the Standing Technical Committee, and the Standing Technical Committee supports us identifying what are the priority research to be conducted for FMD, but also for other transboundary animal diseases, and also highlight any issues that there might be present for the control of FMD. And the enlarging this opportunity to other scientists will bring insights into our work plan. So that would be very relevant and very useful for we hope for the scientific community, but also for the EuFMD work and activity.
Right, perfect.
Maybe you can organize another session to respond to all the questions that were appearing on the screen. But I would like maybe just to mention that now EuFMD is quite a big team. It is composed by technical staff with different expertise, and also operational staff that supports very well all the activities that are proposed. And actually, for these events, really each of the staff has a task. So it's really a combined effort towards we hope, organized conference in December.
Yes, very good point, Fabrizio. And also I want to say, also our extended network of people or focal points in different countries and regions who have contributed to this work a lot, and also our own colleagues that you mentioned. So I think with those words, it's time to close this session. and thank everyone basically who attended this live event, and also those who will be hearing us later as a recorded version of this. But as I said, this was our first experience being live on EuFMD's Instagram. So I hope we provided some good background to our open session, which will be held in December. And I really encourage you to go and register, because the places are quite few left. And then yeah, I hope you will be able to attend. With those words, I think we should say goodbye to our audience. Fabrizio?
No, we should say see you in December.
Perfect. I agree. See you in December, and well, virtually.
Virtually.
And I hope soon we can also meet face to face for the next one, perhaps.
Thank you very much, Bouda, for this and all the work that you are doing.
Thank you. Thanks very much. See you later.
See you.